According to Comparatech, the average American spends about 7 hours, 4 minutes looking at a screen every day. This can, of course, cause eye strain, headaches, dry eyes, and blurred vision.
There's a new partnership called the Screen Time Alliance that's trying to put a spotlight on the issue and offer some solutions to it. And joining us to talk about it is Dr. Jason Compton, a member of the American Optometric Association. Good morning, Jason. How are you, sir?
Good morning. Great to be here.
So, Doctor, how should someone keep their eyes safe during all this screen time? I mean, that's a lot, over 7 hours a day.
Well, generally, our first recommendation is an in-person comprehensive eye exam. It's really during that time where a doctor can figure out if there are any specific conditions or diagnoses that should be monitored. With my patients, for me, it's very important that I encourage healthy screen habits and really try to limit time. One way that you can encourage healthy screen habits is something simple as what we call the 20-20-20 rule. The 20-20 rule is something simple where for every 20 minutes, I encourage my patients just to take a 20-second break by looking at something far away. Looking at something far relaxes the eyes.
Okay, we'll have to remember
Doing
that
it right
one,
now.
right?
I don't have 20 today.
Doctor, can you talk a little bit about the long-term side effects of too much screen time, and does it vary depending on age?
That's a very good question. When we're talking about prolonged use of these devices, it translates into something we call digital eye strain, or some people refer to as computer vision syndrome. There's a lot of things that are connected with it. The dry eyes, because we're focusing on something, not blinking as much. The headaches, because of the strain on the symptoms. The light sensitivity, glare, blurred vision, itching. These things can manifest as minor problems for some people, but for other people, it's severe health conditions. And as you noted correctly, with age, there's definitely an interesting dynamic there.
So, Doctor, can you tell us a little more about this new partnership that we mentioned between the association and the gaming industry, the Screen Time Alliance?
So we're really excited about this because it's really the first of its kind. Because the first time you have an eye care professional organization teaming up with the gaming industry. Why it's important is it goes back to this educating the American public. Educating the American public on proper habits when we're doing this excessive screen time, but also more importantly, understanding the importance of an in-person comprehensive eye exam from a doctor of optometry.
And doctor, how often should those comprehensive exams be taking place, and what are the benefits to those?
Excellent question. Generally, in my practice, follow-ups are based on patient symptoms or findings, but the general recommendation from the American Optometric Association is an annual eye exam.
Okay.
All right. Now, Doctor, we mentioned the 20-second break every 20 minutes. You know, as a parent of a teenage boy who plays games all the time, can I immediately run upstairs and say, Dr. Compton says you need to shut this game off and pick up a book, go cut the yard? What can I do here, Doc? Help me out.
You know, it's so funny. I get this every single time. Parent comes to my room, so tell my kid to stop playing Roblox. Tell my kid to stop playing. Listen, I'm not here to shame gamers because inherently games aren't the problem with the eyes. It's the time that we're spent in front of those devices. And that's really what we want to encourage. And the 20-20-20 rule is just a quick reminder just to get people in the idea of prioritizing eye health. And that's just taking slight breaks.
Okay. I go throw stuff up at his window or
There you go. Dr.
floor.
Compton said we're still going to use that tonight. Thank you so much, Dr. Jason Compton, member of the American Optometric Association. We appreciate your time this morning.
Thank you.